Hello, this is Dr. Feast Price, and I'd like for us to continue our discussion on family therapy by focusing on additional therapeutic treatment approaches. Specifically, I'd like for us to explore experiential family therapy, as well as behavioral and cognitive behavioral family therapies. And so when we consider experiential family therapy, we recognize that the premise behind this approach is that family problems are rooted in the suppression of feelings. There's rigidity in terms of roles and responsibility. There's a denial of impulses and urges. There's a lack of awareness of self as well as others. There's emotional deadness. And there's also an overuse of defense mechanisms. So when you consider some of the defense mechanisms as projection, sublimation, denial, repression, these are all defense mechanisms that persons use when they're in situations of distress. Both Carl Whitaker, as well as Virginia Satir are the two names most associated with experiential family therapy. And so you'll find that with Whitaker, he uses or espouses fewer techniques. However, Virginia Satir uses far more structured activities to bring about an understanding for the individual. But with experiential family therapy, regardless to whether you follow those approaches espoused by Whitaker or Satir, they are experiential family therapy place emphasis on the present, as well as on increasing awareness among family members through actions in the here and now. They're humanistic and they're also phenomenological in origin. And so it's helping to assist persons overcome their problems based upon their existence of their circumstance. So you're helping people to overcome adversities based upon what their subjective realities are, rather than based upon what we believe to be most important. So with Carl Whitaker, he identified 7 active interventions. And so what I'd like to do is just take a little bit of time to unpack some of what was espoused by Whitaker. He believes in using the power of the personalities as a technique to bring about change. So he recognizes what are the personality attributes of individuals and assist them by focusing on some of their personal attributes. He also disregards theory and emphasizes intuitive spontaneity. And so with Whitaker, he redefines symptoms as efforts of growth. So specifically, he believes that all behavior is oriented towards growth, even though it may look otherwise. So persons might be involved in dysfunctional behavior, but he recognized that the behavior serves a purpose, and that what's important is to help individuals to redefine their behavior, to find more pro-social ways of achieving their goals that might be healthier and bring about more of a positive outcome. And so by viewing symptoms as a way to bring about positive outcomes and moving toward growth, the therapist is able to help the families to see how previously unproductive behaviors are meaningful. They serve a meaningful role. And also he believes that you should help families to evaluate the symptoms as ways of helping the family to develop more of a homeostasis. But once you help the person to redefine the symptoms, you're helping them to identify more pro-social ways of behaving where everyone within the family system can benefit. There is separate interpersonal there's a separation between interpersonal stress and intrapersonal stress. And what that means is that some of the problems or issues that individuals present with may be intrapersonal or specific to the individual, as well as some of the problems might be more interpersonal, the ways in which they communicate with others. So if there's a recognition that some of the problems are interpersonal, the therapist may assist family members in developing effective ways of communicating, of problem solving, and interacting with others in ways that achieve more of a positive outcome. If some of the problems are intrapersonal or within the individual, then you look for ways of positively impacting the way in which the individual might function. There's also adding practical bits of intervention. And so one of the things that your book talks about is that sometimes family members require some practical or concrete information to make some of the changes that are needed. So let's say if an adolescent male is struggling with certain kinds of identity issues, it might be helpful to the individual to know that their father also struggled during their teenage years to identify an identity and to function normally. And so what it does is it helps to normalize and legitimize a person's experience, to realize that what they are experiencing isn't unique to them. Number 4 is an opportunity to augment the despair of a family member. So augmenting the despair of a family member means to enlarge or magnify the person's feelings so that other family members and the family as a whole understand that individual better. So when families have difficulties, they often deny that any of their members are in pain. And so you want to help others to become aware and understand what some of the problems are, so that they can better understand the problems of others and maybe develop more empathy and assist the person in overcoming adversities and differences as well. So additionally, family members may suppress their feelings, and augmenting despair prevents the occurrence from persons using defense mechanisms such as denial or suppression of their feelings. But instead, when you augment the despair, when you magnify the despair, it allows them to experience it, family members to experience it as well, but identifying more healthy ways of coping and behaving. Promoting affection and confrontation is also important. So as mentioned earlier, a major premise of the experiential approach, and approaches are associated with its emphasis on the primacy of emotions. So what's happening in the here and now. Therefore, you want to help the client or the family by confronting some of the problems more directly. And in doing so, you want to examine their feelings before exploring the behaviors. So you want to give more attention to some of the feelings that a person has rather than just focusing on the behavior. So promote affection confrontation. You also want to treat children like children and not like peers. There's major emphasis on the importance that children must be treated in ways that are age appropriate. Although children are valued as a part of the therapeutic process, they are treated differently than the rest of the family, so they're not given the same voice. And so Whitaker believes that children must be treated like children and not peers. There's one other technique that Whitaker espouses, and he talks about a model fantasy alternative to real life stress. And so sometimes change is fostered by going outside the realm of the experienced or the conventional. So, modeling fantasy alternatives is one of the ways of assessing whether or not a client's family likes ideas that work for everyone. So, the modeling may be done through role playing by either the therapist or the family. And so, allowing them to model what they believe an ideal family structure is, and that's called model fantasy alternative to real life stress. So Virginia Satir is also another one who brings a lot of information to experiential family therapy. She believes in metaphorical as well as concrete techniques. And among the techniques of Virginia Satir is using I statements. Oftentimes it's the person's teaching. It's important to teach individual to take ownership of how they feel rather than projecting their feelings onto others. So to help people to move away from statements of we or them or they. It's to make more I statements. I feel sad when there's dysfunction in the family, or I feel unhappy when certain things happen. So we recognize that I statements allow a person to not only take ownership, but it also gives them the ability to recognize how they can impact their circumstances. And so one of the additional attributes of Satir's approaches is modeling and teaching clear communication, and that was the use of I statements. Satir also believes in the importance of sculpting. And in sculpting, family members are molded during the therapy session into positions symbolizing their actual relationships, as seen by by one or more persons of the family. So this puts me in mind of psychodrama, where you have individuals within the family that are given certain roles and positions. So if one person is perceived as like the baby of the family, then in sculpting, that person is to act in ways as though they're the baby, but it's really to magnify or bring attention to those kinds of behaviors. So with sculpting, it consists of 3 roles or 4 steps, and the 3 roles are those of the sculptor, so that is the client family members, who sculpts the family members into specific positions. And then number 2, there's the facilitator, which is the family therapist, and that the family therapist serves as the supporter who protects and guides the sculpting. And then you have family members who participate, observe, or comment on the sculpting. And so these 4 steps in the sculpting process involves setting the scene, choosing the role players, and creating a sculptor. So who in the family will serve as the sculptor, and processing the sculptor. So after this sculpting has occurred, then there's the processing where a lot of the knowledge takes place. You have to be mindful that not every family will come in and feel comfortable playing out sculpting, getting into scenes and playing out scenes, but nevertheless it's important to understand that these are one of the ways in which Satir used techniques to bring about awareness as well as behavior change. There's also choreography, and family members are asked to symbolically enact a pattern or a sequence in their relationship with one another. So like, let's say if there was an argument that might have transpired, this process might allow the individuals to play out the scene all over again to understand what occurred and what could have occurred differently. And so sometimes this might be done through miming or a silent movie. But again, it's recreating scenes that might have occurred within the family to not only highlight the problem, but to also bring about awareness and understanding. Some people believe that some of these techniques are far more beneficial than talk therapy because it promotes a greater level of awareness because it uses different kinds of senses in order to bring about that awareness. In like manner, another one of Virginia Satir's approaches involves humor. So creating humor within a family therapy session can be risky, but it's believed that successful humor can reduce tension and promote insight. So you might want to help people to figure out ways of laughing at their problems or not taking things too seriously. But again, as was said, you run a risk because sometimes people might find that if you're laughing or trying to make light of some of the problems, they might find it inappropriate or they might take offense to it, and they might believe that the proper attention and recognition isn't given to a particular family problem. The use of touch is very important, and it's something that's used by a large number of experiential family therapists, not just Virginia Satir, but also Carl Whitaker. He believes that best known practitioners use touch as a communicative tool in family therapy. So touch may be putting one's arms around another, patting a person's shoulder, shaking hands, or even in an extreme case, wrestling. So you decide what works for you. Typically, if I'm working with clients and they're crying, I give them the permission to cry by giving them silence. I don't touch, I don't try and hug. I think that could be misconstrued. So you have to figure out which of these tools and techniques are most appropriate for your style in working with other individuals. So in using touch, experiential family therapists are careful not to violate the personal boundaries of their clients. However, they recognize that physical touch is representative of caring and concern, and it must be done appropriately, and it must not be overused. So again, you figure out the extent to which that is something you would employ in working with clients. Props are another part of the approach of Satir, and props are materials used to represent behavior or to illustrate the impact of action. So when I think of props, sometimes if I believe there's an elephant in the room that people are not discussing, I might take this stuffed elephant, put it in the middle of the floor, and I say, you know what, I'm sensing that there's an elephant in the room. I'd like for you to tell me what this elephant represents. And so it provides people with opportunities to open up discussion and dialogue to get to some of the core issues. There is also reconstruction that exists within the family. So with family reconstruction, it involves a therapeutic innovation that allow people to reconstruct different aspects of their family. And in reconstruction, there's also redefining roles and positions and looking at more effective ways of releasing power to give others ample position as well as recognition within the family. So it's important to help guide family members in their ability to positively reconstruct a family so that every family member can get their needs met. So play therapy is another form of approach used by experiential family therapists. And in play therapy, it allows people to either play games that bring about awareness. Filial therapy addresses the child's problems in the context of the parent-child relationship, and so that too is another form of therapy that exists. And there's also puppet interviews whereby individuals are able to act as puppets, but you interview them in order to obtain relevant information. So it's less direct, and it's the belief that if you use some of these more creative ways of obtaining information and sharing information, you can bring about a more positive outcome. So experiential family therapy, with regard to the role of the therapist, is the use of your personality. Each of us as therapists bring different personality traits and strengths, and so you use your personality to impact change. You must be open, spontaneous, empathic, as well as sensitive. You must demonstrate caring as well as acceptance as it relates to your client. And this relates to the humanistic aspect of the work that we do in family therapy. You must be willing to share and risk. However, you must be genuine and increase stress within the family and its members in order to bring about change. I think sharing is important, but the rule to sharing is that you're doing it for the benefit of your clients and not for your own benefit. So it has to have relevance. And for the therapist that is sharing, whatever you're sharing must not be of present importance. You cannot be emotionally tied to what it is you're communicating, because if that is the case, it can be far more emotional for you than it is for the client. And then there can be role issues if you lose your professional ability within the therapeutic context. You must also deal with regression therapeutically. Sometimes clients do regress. You want to teach family members new skills in clearly communicating their feelings. So when family members recognize that you can in fact communicate your feelings in clear and constructive ways, you are assisting them in using skills that they may not currently have. So in experiential family therapy, in terms of process and outcome, you want family members to become more aware of their needs and feelings. And as it relates to Whitaker, he believes that it occurs in 3 phases: engagement, involvement, and disentangulation, which is similar to the detriangulation or diffusing of some of those boundaries. However, therapy by Virginia Satir, she said it also occurs in 3 stages, but her stages include making contact, creating chaos, and then from that chaos, reintegrating individuals in a normal state of functioning or more productive state of functioning. The therapist as well as families focus on enhancing structure and taking the initiative, because whenever change is brought about, individuals must then take the initiative to behave in ways that are different from the ways in which they've behaved previously. So in comparison with other therapeutic approaches, we recognize that with experiential family therapy, there's comparison with other therapeutic approaches, but it is most effective when the therapist is sensitive and spontaneous, creative, and they use really good timing. Also, they're present focused. And if the therapist isn't present focused, focus on what is happening in the here and now, they could miss historical patterns that might help to alleviate some of the problems. It also conveys that within experiential family therapy, it's not systems oriented. So while the family might function as a system, it's looking at the ways in which individuals function from an individual perspective rather than us allowing the system to function more productively. Additionally, in comparison with other family therapies, it overemphasizes emotions and it fails to provide solutions for future concerns. So a lot of experiential family therapy is based upon functioning, is based upon emotions and feelings. And so sometimes when the focus is on emotions and feelings, it doesn't always translate to the focus of solutions and changing behavior for the long term. So in a nutshell, this provides you with an overview of experiential family therapy. We've discussed some of the issues that are specific to Whitaker as well as Satir. I think that Satir provides a lot of therapeutic techniques that you may find beneficial, particularly if you're a spontaneous therapist that feels comfortable promoting acting or reenacting and plays and puppetry, then this would be an ideal way to impact change. And so it's using a lot of movement and play therapy in order to execute change within the individual as well as within the family. So I'd like for us now to turn our attention to behavioral as well as cognitive behavioral family therapy. And so what I'd like to do here is just give you a brief overview of this therapeutic approach, realizing that if this is an approach you identify a lot with, then I would encourage you to spend additional time researching the topic so that you can gain additional information to positively impact your way of interacting and behaving with clients. So behavior is maintained or eliminated by consequences, and it's when you look at behavior, it's tied in what is reinforced. Behavior serves as a purpose. So it's either maintained or eliminated based upon consequences or reinforcements. Maladaptive behaviors can be unlearned or modified. It also believes a premise behind behavioral as well as cognitive behavioral family therapy is that adaptive behaviors can be learned. So if you want to assist individuals in changing their circumstances, you want to assist them by changing their behaviors. And so not everyone in the family has to be treated for the change to take place. Within behavior therapy or cognitive behavioral therapy, if certain individuals within the family, if their behavior changes, the entire system or unit will change. And thus, within these therapeutic approaches, there isn't the belief that everyone within the family must be treated in order for change to occur. In like manner, cognitions are either rational or irrational, and they can be not modified, and you can bring about a change in a couple or family's behavior as well as their interactions if you can impact cognitions. So what's core here is helping people to recognize it's not the antecedent or it's not the situation that occurred, it's the way in which an individual understands or makes sense of that situation, and that impacts the feelings as well as the behavior. And so when you can change the cognitions, you can also change the behaviors. However, behaviorists believe that you can just change the behavior, and by changing that behavior, it'll ultimately change the cognitions and ways of receiving outcomes. So behavioral and cognitive behavioral family therapy, there are 3 types of therapies that fit within this treatment modality umbrella. And so behavioral parent training is one. There's also functional family therapy. There's also behavioral treatment for sexual dysfunctions, as well as cognitive behavioral family therapy. So these are the four most prevalent forms of behavioral and cognitive behavioral family therapy approaches for parent training, functional family therapy, behavioral treatment for sexual dysfunctions, as well as cognitive behavioral family therapy. So in terms of some of the treatment techniques for with behavioral family therapy, the focus is on parent training, interpersonal family functioning, and the treatment of sexual dysfunctions and working with the family as a whole. For cognitive behavioral family function, in terms of the treatment techniques, there's more of an emphasis on working with those that are under stress, but it emphasizes more thoughts and behaviors. So with behavioral family therapy, it's focused more on behaving differently, treating individuals differently, functioning differently in sexual situation, working with the family as a whole. And cognitive behavioral family therapy emphasizes working with those under stress, and they believe that if you work with certain individuals, it'll be transmitted into the family. And the emphasis is not only on thoughts, but also on behavior. So both cognitions as well as behavior. With behavioral family therapy, in terms of some of the treatment techniques, individuals and dyads are seen more than families. And so there is the modification of behavior based on the consequences of the actions. And so there is a need to eliminate undesirable behavior and accelerate the use of positive behavior. There is also the focus on teaching social skills and preventing problems from reoccurring. Additionally, behavioral family therapists they promote more competence, and they foster an understanding of behavior. So it's more behavioral based, it's less focused on cognitions, and sometimes the attitude is just do it, just behave differently. And when you behave differently, the consequences change and the awareness may come, but it doesn't focus on awareness nearly as much as it focuses on behaving differently. But it's helping the individual to understand how their behavior impact their outcome or their consequences. With cognitive behavioral family therapy, their technique has a focus on modifying irrational or unproductive beliefs and the behaviors that go with them. So if you focus on the cognitions and why people think the way they do, then if you change their thoughts, then the behaviors will also be impacted as well. And so you're wanting to focus on modifying the family members' cognitions as well as interactions. So behavior is really perceived as a byproduct of one's cognition. So oftentimes the focus is on understanding the cognitions associated with the problems. And if the cognitions are changed, then the behaviors will also be changed. So with behavioral and cognitive behavioral family therapy, some of the approaches that are used involve communication and problem-solving skills, educating the family about relevant information that they may not be aware of. Sometimes it's connecting them with other resources that exist to bring about some of the awareness that might be needed. Identifying some of the strategies that would be most effective. Operant conditioning and classical conditioning, it has a lot to do with rewards and how things are reinforced, developing contracts, coaching, Extinction is also when you fail to reward certain behavior, they become extinct. There are also issues related to positive reinforcement, which increases the likelihood that certain behaviors will occur. There's quid pro quo. I will do, if one person does one behavior, the other person will complement the other by doing what the other person needs done. Reciprocity, which is give and take that exist, reshaping the behaviors. Systematic desensitization, timeout, grounding or centering, helping a person to be grounded or centered, charting or making lists. The PREMAC principle, which means that people are more likely to do those behaviors when they are rewarded. So if you want to, it's like telling yourself, after you study for your exam, then you reward yourself by going for ice cream. So those are instances where certain things you may not want to do, by doing them, then you can get a greater reward later on. Also important among cognitive behavioral therapies as well as behavioral therapies is disputing irrational thoughts. So helping an individual to recognize their thoughts and to dispute those. Thought stopping is another important technique. So sometimes people have this endless loop that they play and replay in their heads over and over. And so the key is to help individuals to stop the replay that exists within their heads. So thought stopping. Self-instructional training. So you instruct yourself on what to do in certain situations so that things don't occur in ways that are not favorable. And modeling and role playing are also very important techniques that exist with behavioral as well as cognitive behavioral family therapies. And so I do encourage you to spend some time reading more information about some of these if they're of particular importance to you. Some of the approaches, the treatment approaches that you've learned in theories and techniques of counseling are also consistent with what you will find here as it relates to family therapy as well. And so the role of the therapist is to function as a teacher, a collaborator, or coach, an expert. You want to focus on the presenting problem. You want to model effective communication by giving corrective feedback, as well as helping the clients to learn new behaviors. And so there are 5 phases in the treatment process that exist for cognitive behavioral therapy as well as behavioral therapy. And that's the introduction, the assessment of the problem, the motivation that exists within individuals to change. There's the behavior change that exists, and then there's the termination of the treatment process. Once the presenting problem is eradicated and the goals have been achieved. So there are certain processes and outcomes that are associated with behavioral and cognitive behavioral family therapy. Included are members modify, change, or increase or decrease certain behaviors and or thoughts. You want to increase skills. For example, there might be parenting skills or interpersonal skills or sexual behaviors. So you might want to increase certain kinds of skills within the individual as well as the family. Also, members and family eventually learn to modify their behaviors independently. And so it doesn't always happen synchronously among the entire family, but each individual functions within their own time and their own frame of reference. So again, this is just a repeat of some of, I went in the wrong direction, my apologies. So in comparison to other therapeutic approaches, behavioral and cognitive behavioral family therapy, behaviorists work on individuals rather than the system concerned. So it's helping each individual within the family system to function and behave in ways that release or alleviate some of the problems. Behaviorists, they don't focus on the affect. The responses they primarily focus on emotional problems. And there is also the focus on behavior. So behaviorists, they don't look at feelings, the affect responses. They look at emotional problems that exist. And with cognitive behavioral family therapy, it has an integrated concept of working with individuals and methods from other therapies. So CBFT integrates many other concepts from other methods and therapeutic treatment approaches that allows this kind of approach to be most effective. There's disregard for the use of historical information, and there is the belief that there's too much emphasis on action rather than family dynamics. And so rather than always focused on action or family dynamics, rather than focus on action or behavior change, sometimes there needs to be the focus on family dynamics to overcome some of the problems that exist within a family. So in a nutshell, I have provided an overview of behavioral and cognitive behavioral family therapies. I've also provided information on experiential family therapies. Again, you'll find that there is no one size fits all for working with clients. So it's always best to use an eclectic approach and utilize multiple theoretical frameworks, identify those techniques that are most germane, and meet individuals where they are in helping them to overcome issues that limit their ability to maximize their potential and their functioning. So I hope you found this information helpful. With the next lecture, we will discuss structural and strategic family therapy as well. So I hope you found that this information is helpful to you, and I look forward to providing additional information about therapeutic treatment modalities, specifically as it relates to structural and strategic family therapy. Thank you for your attention.